Welcome to This Week in Washington for August the 26th. This was the week not only of the earthquake here in Washington, but the week that we met with CMS to discuss the future of medical transportation, especially as it relates to Medicare recipients and to a special class of Medicare recipients known as dual eligibles. Dual eligibles represent a very significant number of seniors and individuals who have special health needs that don't necessarily qualify for Medicaid transportation, but they do qualify for some Medicaid benefits as well as Medicare. We have proposed that this group of people receive medical transportation under Medicare as a demonstration of why medical transportation must be made available to all Medicare recipients, especially those who need outpatient methodologies like chemotherapy or dialysis or other forms of repeat medical procedures. We had a very good conversation. We had representatives, including the Deputy Administrator of the Office of Coordinated Benefits for Medicare and Medicaid. We had representatives of Medicaid and Medicare, some in transportation, and some in other kinds of financial aspects of those programs, in to talk about how the transportation effort that we wanted to have could impact the cost of Medicare and how it would improve services. It was not a bad meeting. In some respects, it left me very optimistic that they are open to new ideas and open to new ways they can meet the challenges of a population that needs more intensive transportation to take advantage of a commitment for outpatient healthcare services. In the course of our discussions, we did touch on some of the things that are currently at play in the current Medicaid program and the implications this has for Medicare. First, many of you might be surprised to learn that they view the brokerage arrangement that exists now as a temporary solution, one that is evolving toward an involvement of transportation as part of the managed care system. I think that we can look for continued efforts on their part to assign the transportation benefit to who is ever selected as the managed care entity for Medicare or Medicaid as they move further down into that kind of delivery model. I think it's also to be expected as they begin to look at the implications for affordable care patients as well. What this means is that the health care company will be managing the medical services for a patient, and that transportation would be considered one of those services. Whether that company would do it themselves or contract that work out is still something that hasn't been decided, but it's our hope that we could talk about how we could construct that system in a way that transportation people are just as likely to participate in the management of that benefit as are intermediaries. Although the intermediaries may choose to provide the service themselves, there's also a chance that they might want to consider looking at other methods as well. In the course of that discussion, I would also say there was great reluctance on their part to construct such a benefit with or through the states, a sign that there is some degree of frustration with state Medicaid agencies as it relates to the total health care provisions that they provide under Medicaid, as well as problems caused by the significant financial problems of state agencies attempting to manage the overall Medicaid benefit. In looking down the road about the possibilities of reductions in health care areas or even reductions in entitlements, it's clear that the preference in both the administration and the Congress is not to reduce the benefits to individuals, but to reduce the payments to providers. We tend to think of this as someone saying, okay, well, you've been providing transportation for $1, we want this savings. We only want to pay you 90%. Therefore, we'll have the 10% savings. That's not the methodology that's at play here. It's instead one that assigns the benefit completely to be managed by a managed care firm that would determine whether or not an entire trip or an entire x-ray or an entire healthcare procedure would be available. We also spoke about the need to have representation for transportation providers as part of this network. So what we take out of this is we're going to continue to meet with them about possibilities and also ultimately the possibility of a series of demonstrations where Medicare would pay for non-emergency transportation in a variety of communities around the country. We would expect that some of these demonstrations would be assigned to a managed care environment, some a fee-for-service environment, and some to what we call the transit-first environment, and then to measure the outcomes on patient health and the ability of patients to access and use the system. I find this to be an exciting possibility and one that I would not have thought was possible several years ago, but the combination of the growing number of people eligible and the growing need for outpatient services has really caused them to look differently at transportation as they have in the past. Those of you who are more directly involved in Medicaid now, I will be in touch with you as the situation develops so that we can get some additional input from you about ideas and concepts to incorporate in our next round of discussions. So I would say we should leave this discussion optimistically for now, knowing that it is the first time I've ever been to a meeting where Medicare was discussed and the answer was not no or not now, not ever, never. Having said that, as you know, as I mentioned at the beginning, we did have a hurricane this week on top of the earthquake that we already had. We're preparing for the hurricane by looking forward to possibly being closed Monday and urging people here to take all the necessary precautions they can in preparation for this event. I hope you're doing the same thing if you're in the areas that are affected. I already know that a large number of our members will be being involved in the evacuations and rescues, and I certainly wish you and them well in the days and hours ahead. So I'll be in touch next week. I will be looking forward to talking to some of you individually about Medicare, and I think this is a good week for us to think that it is still possible to make our argument work regardless of the difficulties in this political environment. Thanks, take care, and good luck over this weekend. Bye for now.